Hey everybody, this is Dr. Shrigani from Manhasset Rheumatology. Today I'm going to talk about different kinds of arthritis. Arthritis basically means that the joint space between two bones has either joint space narrowing or inflammation. There's different kinds of arthritis, but the easiest way to break it down is if it is a non-inflammatory arthritis versus an inflammatory arthritis. And traditionally, you could tell if there's inflammation in the capsular joint space if you were to take a needle and check the fluid of the joint space under microscopy and see how many white blood cells are present, or if you see signs of inflammation on an MRI of a joint space. So typically, non-inflammatory arthritis, we think about osteoarthritis, which is just wear and tear arthritis, where it's the most common in older people, and the joint pain really gets exacerbated by rainy day or with activity, and it improves with rest. When we think about our inflammatory arthritis, where there's a lot of inflammation or swelling of a joint, we think about our crystal arthritises like gout or pseudo-gout. We think about our autoimmune arthritis like rheumatoid arthritis, psoriatic arthritis, mixed connective tissue disease, arthritis such as lupus, Sjogren's, scleroderma, etc. So this is the way you categorize an arthritis, non-inflammatory versus inflammatory. Whenever you speak to a rheumatologist or your doctor, what we want to hear about to distinguish if it's non-inflammatory versus inflammatory is if you see swollen joints, that is unusual. Swollen, warm, red joints that you notice is definitely not normal. If you have morning hand stiffness for at least half an hour or longer, is also not normal. So we call these inflammatory arthritis symptoms. And these are kind of the signs or clues for somebody to go get checked out by a rheumatologist. And what a rheumatologist typically does is we listen to your story, try to hear if it sounds like an inflammatory arthritis, and then we will check the proper blood work and imaging to try to verify the diagnosis. Whenever there's inflammation, we typically treat with a short course of steroids, but to get the true steroid-sparing medication for whatever condition is causing the inflammation of the joint, that will be determined based on clinical exam, blood work, and imaging to give the final diagnosis. But this is basically how you think of your different kinds of arthritis. If you have any joint pain or have any questions, leave a question below. If you're looking for a rheumatologist, check us out at Manhasset Rheumatology. Thank you.